radio station. And don't forget, you can watch us too. We are on your computer, your mobile device. Just head on over to SuperTalk TV. It's that time of year where we remind you of the Mississippi Team Hope Walk benefiting Huntington's disease. It's coming up Saturday, May the 17th. We've got our favorite champion here, Heather Thurgood, who is part of our SuperTalk family, but also really the big advocate here, I think, in this state for Huntington disease and the families it affects. And I look forward to having you in each year because I feel like the awareness is growing. Do we feel like we're doing that?
I think so. I really do. When Nathan first got diagnosed in 2016, I always had to explain it. And now I feel like, he's got Huntington's disease. And I go into, it's like having ALS, Parkinson's, Alzheimer's all at the same time. And people cut me off and go, I know what that is. So it's working.
Yeah.
Slowly, but it's working.
Slowly but surely.
Yeah.
Absolutely.
So we're excited about that.
So you're excited, too, about the walk. This is an opportunity to, I know it's an awareness-raising efforts, but then it's also just a fellowship and community-building effort. So tell us about the walk.
Well, Team Hope Mississippi, the walk is, like you said, May 17th. It is a fundraising effort for the Huntington's Disease Society of America. HDSA was founded by Marjorie Guthrie, who is the wife of folk singer Woody Guthrie, as a way, kind of like what we're trying to do here in trying to find people that are suffering from this disease and just basically let them know you're not alone. Mm-hmm. And HDSA does a lot in the community, and these funds raise for centers of excellence, and we have one right here in Mississippi,
which I think is because of you.
Well, I
don't think you wouldn't be the only piece to that puzzle, but it would be a big piece to it. You and your efforts and your families, as well as UMC, who understood or recognized the benefit of having a center of excellence in our state to help our patients.
Well, and see, we got lucky. A lot of HD patients aren't as lucky as we were. We were paired immediately with Dr. Jubin Wong, and he runs the clinic, and he worked really hard with his team to make UMMC a center of excellence. And it took a while. Yes, I signed the letter of recommendation. I don't know that helped any, but I wrote it too. So, but anyhow,
give yourself a little credit. And for those who may wonder, if you didn't have your healthcare providers there at UMC, or at least centrally located, you and your family, being you and your husband, where would you have to have gone?
Well, and we do go to UAB in Birmingham. Because when Nathan first got diagnosed, we didn't have a center of excellence here, and HDSA does not hand out that designation lightly. There's a lot of work that goes into that, and Dr. Sung at UAB, Victor Sung, is our other doctor. We couldn't go for one doctor. We have two. Mm-hmm. But we were really lucky in that the two that we were immediately connected with were so hugely into helping people with HD that, a lot of people are not that lucky or blessed. And so that's another reason why we share our story. I mean, if you see my social media, especially for the month of May, because May is Huntington's Disease Awareness Month. And, we sing their praises because they are, they know what they're doing.
Heather, not many people use the words lucky and blessed when it comes to talking about a diagnosis of Huntington's. But I feel like one of the things that I have and has inspired me the most by you and your husband's journey with this is your openness, your willingness to be transparent, but then finding the good in your story and being able to hang on to that. Is that intentional every day you wake up and try to hang on to the light? Yeah.
When Nathan first got diagnosed, we felt so alone. We didn't know anyone that was dealing with this disease. And we felt like, for lack of a better way of putting it, that the other shoe was about to fall and drop. Because we had this attitude of Nathan's gotten this terminal diagnosis because there's no treatment, there's no cure. They can help treat the symptoms, like Nathan's movements in Korea and things like that, but they can't treat the disease. So we had this attitude of Nathan was on his last days. And then he had a friend and I had someone from my past that both passed away unexpectedly. And, I told Nathan as we were leaving our first Enroll HD appointment at UAB, we've been living the past few months of finding this out, like you're going to die tomorrow. These people that we knew, this, brother to you type, did not wake up that morning knowing he was not going to see
Nobody's
tomorrow.
Nobody's promised tomorrow.
Exactly.
Healthy individuals, people who've gotten unfortunate, health diagnoses. I mean,
yeah.
So,
Nathan was like, you're right. And so we don't look at the cannots, we look at the cans. For example, right now, like if you go to my social media right now and, you'll see a video that I took on Sunday. I posted it Sunday of Nathan's movements and how his speech is very garbled. I liken it to sometimes like when your children are little and you're the only one that understands what they're saying. Sometimes Nathan is like that. For the most part, he can be understood, but it's very garbled, and sometimes you have to really stop and pay attention. And, he can still talk. He can still communicate. He doesn't have to have the speech device, right? I mean, I want him to learn on it. If I could get him to quit playing the games and start learning how to run the machine, that'd be great. But, and I mean, don't get me wrong, we both have our down days. And, but being that we've got this terminal diagnosis, we would rather live with positivity because that brings a better quality of life, I feel.
Everybody.
And he does too.
How long have you and your husband been walking the journey of Huntington's?
Nathan's been walking it his whole life. His mom passed away. She went into a nursing home when he was about 5. And then she passed away when he was about 11. And then he got diagnosed on April 15th of 2016. So that's when it really hit my life. I mean, when we were dating, I can remember he and his sister talking about things that happened when they were young and their mom dealing with the disease. But, it was a disease I hadn't heard of. I mean, don't get me wrong. I knew going into marrying Nathan that this was a possibility. You never think it's going to happen to you. But, he was and still is worth it.
Well, and two, I think you are the perfect partner that God had plans for, because look at the good the two of you have done in just Mississippi and bringing the awareness, educating families, making sure families who also get a diagnosis nobody wants to hear feel seen, heard, and at least involved, or can be. And how many, days you've made better just by sharing your story. I truly believe that, Heather.
Well, I appreciate that. I'm just sharing the story to bring awareness. In Mississippi, the last estimate I had was that we have about 200 families in Mississippi. Well, that's not really an accurate number, because 200 families, well, for example, we're a family of 4. I may cry on this, but we just found out that my bonus child has the disease too. We found out back in July. So we're a family of 4 that has 2 patients with Huntington's in the family. So that 200 families really isn't an accurate number.
Because you never know when the next one's going to be necessarily
Exactly. Because our son, he's 10, and he's considered at risk. And he won't be tested until he makes that. That's his decision. I'm not influencing that in any way, but he can't make that decision until he's 18. Is that
like due to like the way the disease progresses, or like?
Well, if they're showing signs and symptoms, the physical of juvenile Huntington's, which as bad as Huntington's is, watching your babies go through this, and it hits the kids hard. I don't know that I would. I might let Hayden get away with whatever he wants to if I knew he had this coming for him.
I don't laugh at that. I mean,
no, I get it. No,
your mama doesn't know, so your room stays clean.
Yeah, you're a mom, so you get where I'm coming from. Yeah. And, if they just won't, because they want kids to have as normal of a life as they can.
Right. And part of that is just knowing that you have the fellowship in the community, which you guys are building through the Team Hope Walk. We're going to get to that and more coming up with Heather next year on Good TV. We're continuing our conversation with one of our favorites, Heather Thurgood. She works out of the Brookhaven office, and she also does plays. Your latest there for the Little Theater.
Yeah, Pike County Little Theater. I don't get to do them very often because Huntington's has, taken over our whole life. And I don't really have anybody that can stay with Nathan during the evenings. So he and Hayden had to go with me. And our director was Randy Bullock, who works at the Brookhaven office with me. And he gives me grief, but he was very understanding, and he knew, because this part was just right up my alley. The character of Betty was a radio DJ, and I've been in radio for 30 years, started off as a DJ, and it was just a lot of the lines in it really hit home and reflected conversations we've had at the office and reflected lines I've had in other plays. And it was just, I had to go home, and I asked Nathan, I said, would you be willing? He's like, do it.
Yeah, you still got to have that thing that brings you joy. But the other thing that brings you joy is bringing people together around Huntington's, just so they know that they're not alone. And that is one way you've done that, is grow this Mississippi Team Hope Walk that's every May, because May is Huntington's Awareness Month, and it's coming up this Saturday the 17th. So give us the good details about that and how people can get involved.
You can go online to www.hdsa.org/THWMS, which stands for Team Hope Walk Mississippi. I have to spell it out in my head. This is our fourth walk, and I still have to do that. Or you can contact SuperTalk. They'll get in touch with me. It's not like they don't know where I am. You can email me, hthurgood@yahoo.com. This is our fourth walk, and we wanted to do this from the first time we'd ever heard of them back in 2016 at UAB's Education Day. It just took us a while to get brave enough to even try.
There's a lot of work goes into it.
It does.
A lot of logistics.
Yeah, a lot of logistics, a lot of trying to get raffle items, which if you are a business out there and would like to donate a raffle item or two, we would gladly accept it. Mm-hmm. We just wanted to find a way, and it started off as just wanting to find a way to find others who were going through what we were going through. Huntington's, and I was telling you during the break, Huntington's hits everyone so differently. Some people lose their personality. Some people don't. We're blessed. Nathan still has his personality.
He's a hoot.
He is. Oh, he was so mad because I had to run by the house real quick to pick up my niece to bring her back home because she stayed with him yesterday. And when I got about 20 minutes down the road, his sitter calls me, and he was mad because I didn't bring him with me.
Aw.
And I was like,
next
time he's coming. But he's like, come back and get me. And I said, baby, I can't. I'm going to be late as it is. But, and he loves, for people that see our social media and think, oh, I can't believe she's putting him out there. He wants to do it. I never post a thing of Nathan without asking first. For example, I shared a video on our social media Sunday and showing some of his movements, and his movements are controlled. Mm-hmm. I shared a post last week where the woman in the video could not control her movements. She can't sit still, arms and legs flailing, and that's part of the disease. And he's, considering what we're dealing with, and he's considered late middle stage. The middle stage is the longest of Huntington's disease. End-stage Huntington's, they're trapped in their bodies. They cannot move. They cannot talk. Most likely a feeding tube, that kind of thing. And, like I said earlier, we focus on the cans, not the can-nots. And so, granted, he can't walk. He has to have help. He can only walk a few steps. But you know what? He can still do it.
He can still do it. And y'all together can still advocate for other families who may not even know this diagnosis is around the corner for them, which, I guess none of us really know what tomorrow brings, as they say. And one way is through advocacy. And I know you're an advocate leader of some kind now. What's your big title, Heather?
Well, I don't necessarily know that it's a HDSA, Huntington's disease. Say that 3 times.
I'm glad you do, and not me.
Huntington's Disease Society of America has what they call advocacy leaders, and I'm the state captain. I'm actually the only person on the team. So anyone who would like to help me get legislation passed to talk to our federal leaders from Mississippi on the needs of our Huntington's community, I would greatly appreciate it.
Would some of the policies also help other?
It would help other diseases as well. For example,
you were just talking about a
safe step. They feel like that one's about to come up, and what Safe Step would do is prevent you from having, say, like, for example, Nathan takes this medication that has worked really well for us, that he's been on for 8 years. Well, there's another medication that we tried first and was terrible. Nathan just, it changed his whole personality. It was not a good fit. Well, if it were to go into effect, in that we would have to stop taking what he's taking and backtrack to the one that we know doesn't work. Well, Safe Step would prevent that from happening.
I'm taking a step back, or
and that's why that's part of the reasoning, I think, for calling it Safe Step. There's several others that would, and these would help other diseases, not just Huntington's. It's just that it would affect our community.
Hard.
Yeah, I think it would affect any community hard. If you've been on a medication for 8 years and you know that it works for you, you don't want to step backwards.
No, y'all are stepping forward into all the things that can and will be done. When it comes to just getting, if someone's listening and they have that in their family, or maybe they're walking through it, someone Tim from the 662, so my best friend, 64 years old, is in his final days with Huntington's. And so, you never, like you said, it's a ripple effect in terms of who it touches. What is the best way to connect with you guys? Obviously, the walk's coming up, and people either can register or donate or, give raffles. But if other communities are looking to create the community that you have or be a part of it.
Really, what we did was right after Nathan got diagnosed, Dave Hughes helped me create a Facebook page.
We know him.
Yeah. He likes to pick on me a lot, too. But anyhow, he helped me and gave me the idea to create a Facebook page. It's called the Mississippi Huntington's Disease Family Awareness and Support Group. Now, I will admit, I'm kind of stringent on when you join, you have to answer questions, and that's just so I know before I accept you in that it's Huntington's, it's Mississippi, and that you're not a fake profile. So we started off that way, and then just SuperTalk allowing us to talk and finding people that way. Now, I tell our Center of Excellence all the time, hey, if you've got somebody that needs somebody to be a friendly ear, give them my number. I don't care. And I'll freely give it here too. But I don't want and never wanted for people to feel as alone as we did when we got his diagnosis, because that's a hard it's a hard diagnosis to get. When you find out you've got a terminal disease, that there's nothing that can be done. And when Nathan got diagnosed, there were only 2 drug companies working towards Huntington's. Now there are over 50.
Praise God. Yeah. And that's what it takes.
And that's what it takes. It takes that. I always say, I don't know, people have quoted me with this, so I use it a lot. I firmly believe, I'm sitting around one day and thought of this, with awareness comes funding, with funding comes research, and with research comes hope for a treatment or a cure. And that's what we want, ultimately. That's what we want. We want a treatment. We want a cure. I don't want my bonus child going through what her dad's going through. I don't want my child to go through having, having to go what his sister's going through.
Right.
And, you know, when Nathan first got diagnosed, I told him his walk was not going to be his mom's walk. My walk was not going to be his dad's. And that's the exact same thing I told my bonus child.
And that's because people are taking part in the Team Hope Walk. See what I did there?
I love it.
And if people want to register, Heather, where do they go?
HDSA.org/THWMS, Team Hope Walk, Mississippi. And we hope to see you there. We would love the more the merrier. And if it's raining, we'll just get under the pavilion and just hang out.
I like it. All right. Well, I appreciate your time, Heather. And you guys stick with us. We got more for you coming up next.